Hi everyone. So in this video we're going to talk about what is the best dental implant. So if you've been thinking about dental implant treatment, you probably found out that there's a whole bunch of different varieties and different brand names available, and what's the difference, which one's the best, why is it the best, why do some cost more than others? So when we're thinking about dental implant treatment, there's a couple of things that we can kind of almost take for granted. The first is if you've got missing teeth, then dental implant treatment is probably the gold standard treatment when it comes to replacing missing teeth. So what I mean by this is it's the closest thing to giving you your natural teeth back. Now, I understand that in some people dental implant treatment may not be the best treatment available to them, but if we're just looking at the laws of averages, for the vast majority of people, dental implant treatment does seem to be the best treatment. The second thing about dental implant treatment, which is a big misconception, is that people think dental implants are forever. The truth is that everything has a lifespan. Any dental treatment has a lifespan. Natural teeth have a lifespan. So if you take care of your natural teeth perfectly from the day that you got them to whenever, you probably won't even ever be looking at a video like this. But if you've lost your natural teeth, then you'll understand that even natural teeth have a lifespan, as do implants. If you take care of dental implants, they will last much longer than if you don't clean them or if you're using them kind of too heavily, if that makes sense. So dental implants are susceptible to heavy bite forces. The third thing about dental implants, which I'm sure you would have figured out by now, is that they are expensive. They're probably the most expensive thing you can have done at the dentist. So taking all of this into account, let's assume for a second that you're not shopping purely on price. If you are, then the differences between the dental implants doesn't really matter. You just always go with the cheapest surgeon with the cheapest implant, right? Now, being a dentist, I would definitely encourage you not to do this, but at the end of the day, it's a personal choice. Now, when it comes to dental implants, how much variation can you get in a screw? I mean, essentially that's all it is, right? You're just putting a screw in the bone, it gets fixed into the bone, and that's it. So why does it matter that one is slightly different to the other? Let's take a slightly deeper dive into this, because I used to think exactly the same, and therefore I would think, you know what, it's titanium, everything sticks, everything works. Now, there's three different levels of implants, okay? So I don't mean like price points or anything like that. I mean, when you put the implant into the bone, it can either be a little bit underneath the bone, we call this subcrestal, and it can be finished at the bone level, which is bone level, or we can have it finishing at the gum. The advantage of the gum ones, or the tissue level implants, is that there's one continuous piece of metal all the way down to the bottom. There's no area where bacteria can seep in. It's thought that this is a more friendly dental implant to the soft tissues, to the gums, and it also helps reduce kind of bone loss around the neck of the implant. The downside is it's not the most aesthetic implant, so the way that the tooth eventually comes out of the gum is a little bit kind of controlled by the position of this collar of implant coming up. So in aesthetic zones, i.e. the front of the mouth where the junction between the tooth and the gum is really important, I wouldn't really recommend this kind of implant. I'd recommend either the bone level implant or the subcrestal implant. Now, both of these two implants have their own advantages. Bone level implants are quite easy to work on. The subcrestal implants usually have something called a platform shift, so the abutment which screws directly into the implant is a bit more narrow than the implant itself, and this takes the junction of the implant versus the abutment, the area where bacteria can sit and be, away from the bone, and again it helps preserve the bone around the implant. Now, this is just one tiny design feature. Let's have a look at the whole implant itself. There's a whole different number of shapes of dental implants. One shape is the parallel-sided implant. So this is the kind of traditional implant shape. You can make a hole and the implant fits directly into that. Now, this is great if you've got really solid hard bone, but what if you've got soft bone? We then have tapered implants, and tapered implants are really cool because they're kind of like a V shape. You make a little hole, and as you're tightening the implant in, what it does, it pushes the bone out sideways, it compresses the bone and increases something called initial stability of the implant. This is how tight the implant is held into the bone as it's placed in. And when we're placing the implant, we use either a ratchet or a gauge built into the drill to measure how much torque there is going in. Okay, so what I mean is how tight the implant is engaging into the bone. And we want this torque value to be relatively high. Most people will aim for somewhere between 30 to 60 Newton centimeters of torque, which is pretty tight. You can't get that just using hand instruments. You have to use either a ratchet or a handpiece to get the implant in. Now, if you've got very soft bone and you've got parallel-sided implant, it's very difficult to get that kind of torque. So that's when a kind of a V-shaped or a conical implant is much more advantageous. Another thing we could look at is the actual threads on the implant. You could have a rectangular cross-section of thread, which is great. It works nicely. It compresses the bone a little bit, and also a lot of implants have it so that the pitch of the threads, the distance between each thread, gets smaller and smaller as you go up the implant. So as you're tightening this thing in, the pitch is compressing the bone, helping to increase the primary stability, which we know is linked to the success of the implant. And conversely, if we've got very hard bone, we can use an implant which has got more of a triangular shape pitch to the thread. And what this does, this cuts into the hard bone rather than trying to compress it. So by now I think you get an idea, that there's a lot of different variations on the implants, all helping in different situations. And we just talking about the implant, we haven't even talked about the surface, whether it's acid etched, whether it's a titanium surface, whether it's titanium oxide, whether it has a negative or a positive charge, and that attracts or repels oxygen, which improves healing. So all of these factors, different implant companies have different surfaces, different types of implants. It's impossible to know which is the best one, and really the question on what is the best implant is kind of useless, because certain implants are better in certain situations, whereas others are better in other situations. About 15-20 years ago, when implant dentistry was still in its kind of early days, what we used to try and do was, when the tooth was out, we just put the implant wherever there was bone. And the kind of protocol for this was, say you had a tooth which needed to be removed, you'd remove the tooth, wait 3 to 6 months, let the bone heal, see what you're left with. If you need to do a bone graft, you do a bone graft, then you put the implant in after the bone graft has healed, and then you put the tooth on top of that. This could be a 6 to 12 month project by the time you're through with it. So we've done a lot to help improve the treatment times, to really cut this treatment time down and still allow adequate healing. What we do is we try and get as much done in one kind of go. So let's say you have a tooth which needs to be removed. As long as there's no really bad infection around this tooth, it's possible to remove the tooth and preserve as much bone as possible. We then pack the bone grafting material into the socket, and we engage in the bone around the socket with the implant. Now, what we're doing here is we're putting an implant in the hole where the tooth came out of, so already we've got less bone. So this is when the individual implant features become really important, because if you've got an implant which has got a very aggressive thread design, it's going to engage in the little bit of bone that you've got, and we're going to get that initial stability of the implant, which, remember, is linked to success. This is what we want. Especially imagine on an all-on-4 case where you've got 4 implants going in, 4 or 6 implants, however many. You want them to all be as tight as possible so that everything is linked and everything is successful. So that's when individual designs of implants do become important, and the quality of the bone. I would use a different implant in kind of what I call standard quality bone, and then if we've got a really soft bone, there's my other preference for the implant for soft bone, which has got a lot of design features designed to get maximum stability in really soft bone. So this whole emphasis on driving down the treatment time is really very patient driven. It's because these days nobody wants to have an Instagram selfie with a missing tooth. Everybody wants to have temporary teeth there or something to fill the gap as quickly as possible. And the kind of more up-to-date dentists kind of think about this and they understand this, which is why we try and give temporary teeth, fixed temporary teeth, in as many situations as we possibly can. If you speak to a lot of dentists, they will categorize dental implants into kind of three categories based on the cost of these implants. So you've got your premium brands like Straumann, Nobel Biocare, Astra, Ankylos, all these kind of brands which are the most expensive for dentists to buy in and ultimately cost the most for our patients. So that's one kind of way of categorizing it. Then you've got your mid-range implants, which cost a bit less, and then you've got your entry-level implants, which I wouldn't touch with a barge pole. They are just a nightmare. You don't want to have the wrong implant from the beginning because it's going to cause you problems all the way down the line. The mid-range implants a lot of them are pretty decent, to be honest. And I mean, this way of categorizing implants is okay, but it doesn't really help anyone. I try and look at each individual patient and the situation and what I'm trying to replace, the kind of timescales we're working with, and then I advise the best kind of implant for that situation. Now, doing this, about 80% of the implants I place are either Straumann dental implants or a company which is owned by Straumann. The reason I've kind of got a little bit of an allegiance with this company is because it is a good quality company. The implants are excellent quality, all the abutments, all the bits that go into the implants, excellent quality, and you can feel the difference. I can feel the difference as a dentist. As a patient, you probably won't know the difference, but if I was a patient, I would want to know that I've got a premium brand dental implant in my head if that's what I needed. Now, Straumann do have all of these variations in their implant design, or they've got the vast majority there, which is why about 20% of the implants I use are non-Straumann. But it's nice to have the ability to choose the exact design of implant for every single situation. It just means that my patients are getting what I genuinely think is the best solution for their individual treatment needs. Another reason I like a big company like Straumann is that, say I do some implant work for my patient and 5 years down the line they move abroad and then they have a tooth which is on an implant and the tooth breaks and they need to replace that tooth. If it's a well-known company, it's going to be really easy for that dentist to find the component. I've got all the information about the dental implant which was used. Straumann's a global company. They can easily get all the components they need to put a new tooth on that implant. A couple of years ago, I had a patient come to see me and he had dental implant work done in India. It was super cheap, and now he was in my chair about 10 years after the work was carried out, and it was all falling to pieces. One of the implants had actually come out completely, and I think almost about 3/4 of the top teeth needed to be replaced. And he had one implant which was still quite firm, but that implant was a really cheap quality implant. And it turns out that being in the UK, I wasn't able to order the components for that implant in India because they just didn't ship to the UK, or they didn't even sell to the UK. They wouldn't even let me open an account. Not only that, but because it was such a limited implant system, it didn't have the choice of abutments which go into the implant system, so it was not suitable for making a full bridge, which is what this patient needed. It was really more suited to just doing single teeth. So now this implant which was placed, and the implant itself is still fine, is completely useless because of the limitations of the implant system. Now, for this patient, we ended up placing 3 implants elsewhere, and we're in the process of making a brand new bridge. But I just want to tell you that story just to give it a little bit of emphasis to show you that a good quality system has almost future-proofing. You can do more stuff with it. It's not limited. And if you think you're saving a couple of pounds by having the treatment done cheaply, having a lower level implant placed, it can actually add a lot of complexity later down the line. You just don't know. In my opinion, it's worth spending a little bit more to get a good quality dental implant placed. So in short, there is no such thing as the best dental implant. There are a whole bunch of really good dental implants available. A lot of it will depend on the kind of the knowledge of the surgeon who you're choosing to have to do this treatment for you. Have the conversation, find out what the best implant is in your case. You know, quite often for my patients, if I don't know what the best implant is, I'll have 2 or 3 ordered and ready to go on the side. And once we start surgery, I'll get a feel of the bone and I'll know exactly what's going to be the best implant for my patient there. So I hope you found this useful. If you did, give it a thumbs up, give it a like, it helps other people find the video. And if you've got any questions or comments, you can just pop them below. Take care.